Hi everyone, welcome back to my channel. So this video is going to be sort of like an amendment to another video. I don't think I've uploaded that other video yet. So I'm thinking that both videos, the one that I previously recorded that hasn't uploaded yet, and this one will probably be uploaded back to back, because I did mention some things in that video that may not be entirely true, because I was just kind of, I guess, guessing. So if you saw my exosomes, and I think I will place this in the exosomes playlist, but if you did see my exosome 3-month update, I mentioned something called GAD65 antibodies, and I did say that I was going to make a video explaining what those were. So I will have that video posted before this one. That way you can at least refer to that first before watching this video. I think if I remember correctly, in that vlog, I talked about how I never had tested positive for GAD65 antibodies. And then my doctor, my immunologist, recently tested me for them after the exosomes treatment, because I was feeling really awful. But she actually didn't know that yet. It was on my blood work and I didn't know. So I went and did my blood work and got the test back and was like, oh my gosh, I tested positive for these antibodies that I had never tested positive for before. And if in the GAD65 vlog, you will see that I talk about different conditions and how I've been diagnosed with one condition that's associated with those antibodies. So what happened since then? So my immunologist is the one that ordered that test. And when it came back positive, I did follow up with her. We got the test. I followed up with her. I didn't know that those antibodies were on that test. So I didn't really I just saw them there and I didn't really talk to her about it. She just was like, oh, your numbers are going down. And we left it at that. I had never been tested for that previously. I checked my other blood tests. There was no other GAD65 tests on there. And I went back. I found my tests from my other neurologist, my regular neurologist here, and my neurologist at UCLA, and another neurologist at UCI. I tested negative for GAD65 antibodies across the board. So it was 3 tests, all negative. So I have no idea why my immunologist ran this test. All I know is that she knew something was going to come up with that test post exosomes treatment. And that is the mystery here. So I'm not going to see her until July, I think. So I'm not going to know. I'm not going to know why she ran those numbers. And she's going to run them again because I did see that on my next blood test. She's asking for that antibody again. So that's the mystery right now. So I did schedule an appointment with my neurologist at UCLA because I really wanted to know. I was like freaking out because I didn't really get any clear answer. And I didn't really even know to ask my immunologist because I was totally unprepared. I went into the appointment just like, what, why is this there? And she just kind of was very dismissive. And she's like, oh, everything's going great. And I'm just, I think I talked about this in the other vlog. So I did talk to my neurologist, and this neurologist, she specializes, I think, in movement disorders and this rare condition of stiff person syndrome, which, like I said, if you haven't watched the GAD65 vlog, watch that one first before watching this one. So I did talk about the controversy behind GAD65 antibodies. It should be in that vlog. And so I did ask her about that. I said, look, I've never tested positive. I have been tested and tested and tested, never tested positive. And she asked me, she said, because I told her that I stopped my IVIG, and that is also in my exosomes 3 months update. So go watch that one also before this video. I told her, I stopped my IVIG. And she asked me, well, when did you stop? She said, when did you stop your IVIG in relation to when this blood work was done? And it was about 10 days apart. So my last IVIG was, I think, 10 days before that, the results, I think before the blood work was done. And she said, well, she said, then it's bogus. She said, because those antibodies could have been from your IVIG and they're still running through your system. So it could have been from the IVIG. It's not necessarily from your own blood work or from your condition, especially if you've tested negative over and over and over again. And so I was like, okay, that does make sense, but it still leaves me with the mystery of why my doctor pulled those numbers, because she knew something, you know what I mean? Like, she wasn't basing it on my treatment with IVIG. She was basing it on, the exosomes, because she's never ordered that test before. So there's something related to this treatment with those antibodies. And I know that those antibodies are related to autoimmune central nervous system disorders and things like that. So I'm now I'm really curious. I don't see her until July, but now I'm kind of wondering, well, why did she pull those numbers if it's a totally bogus number? And again, she didn't know that I was going to stop my IVIG, and I don't think she's even considered the fact that I was on IVIG. And keep in mind, my stiffness and the muscle spasms have been flaring since the exosomes. So I'm kind of like, is it a coincidence that all of those symptoms are flaring and I now have GAD65 antibodies present? Or is my neurologist right and these are coming from the IVIG? So I guess when I do my next test, because I was actually, I talked to my neurologist. She said, you know what, stay off the IVIG until July to see if your body sort of self-regulates, because I was having a lot of issues between, I think, the IVIG and the exosomes treatment. So she said, just stay off of it until July. So, I'm going to be doing another GAD65 test probably at the end of June. And so if that comes back positive, or if anything comes back on that, I don't think we can chalk it up to the IVIG. But I am curious to know what my immunologist says if I tell her, hey, my doctor said that's a bogus number. And it will also be interesting to see, because my pain does seem to be coming down from that flare. So if the number does go down in relation to my pain going down, then I'm guessing it is related to this, neuromuscular issue, or to the stiff person syndrome diagnosis. So, I did question my neurologist, because it's sort of like, on the one hand, it was weird to me, because it's like, okay, then why did you diagnose me with this? I'm very grateful that she did, because I was able to get medication that helped my condition. But at the same time, I know doctors are very reluctant to diagnose you with something that they don't believe you have. And I always kind of got that vibe. Like, I'm getting that vibe now from both doctors, that they don't truly believe that I have stiff person syndrome. Because they both said, your antibodies have to be in the thousands in order for it to be considered stiff person syndrome. So I'm just like, okay, so, why, what was the basis? I kind of told her, well, then why, I was diagnosed without any antibodies. So my neurologist told me, she said, you reported to me that you improved with IVIG. You had this set of symptoms. You improved with the IVIG. So she said, sometimes basically she had to make a clinical diagnosis. She said, do you fit the clinical, the exact clinical presentation of stiff person syndrome? She said, no, but you did report to me that we, that you did improve with IVIG. And if we have a patient telling us that their symptoms improve with this treatment, then it's our job to, to help them and to help their medical condition. So essentially, she made almost like a clinical diagnosis, even though I don't have a typical presentation for stiff person syndrome. On the one hand, it's kind of like, okay, I don't like not having that concrete diagnosis, because I have always believed that I had something else either besides Lyme disease or not Lyme disease at all, because my presentation was never a typical Lyme disease presentation. So I don't have a typical SPS presentation. I don't have a typical Lyme disease presentation. And I'm not just basing this on, my clinical history. I've talked to other people with Lyme disease. I've exchanged notes, and we've all chit-chatted in support groups or just other patients that I've run into in, the doctor's office. And they've always looked at me like I was kind of weird. Like they just did not understand my set of symptoms and my type of disability. It was sort of unusual, and I could tell that just by talking to other people with the same condition. Granted, we don't all present the same. Lyme disease can present itself many, many different ways, also dependent on what co-infections you have. But I just always believed from moment one when I had a physical therapist tell me, it sounds like you might have Lyme disease, you should go see this doctor. And I was like, no, this is not Lyme disease. On the other hand, I do know, especially from being in the, in the Facebook group for stiff person syndrome, that there is no good treatment for stiff person syndrome. There's plasmapheresis, there's IVIG, there's benzodiazepine treatment, muscle relaxers, Botox. These are treatments, these are therapies. Physical therapy is also another thing that people use. But none of them are cures, none of them fix the issue. I believe HSCT has been used successfully in some severe cases of stiff person syndrome. And it's put people into remission, but again, there really is no good treatment. And that's sort of the vibe that I get from most of these people in this group, is that there really is no good treatment. It can get you functioning again, but you're never fully functional. You're never in remission. You're just always treating this condition, I guess for the rest of your life, and hoping that it doesn't get worse. Some people kind of go through periods of no symptoms and then it comes back, or they have the sort of like spasms that come and then go. Whereas mine, my muscles just kind of went into spasm and never came out of spasm. And so I've just been like this for, over a decade. So in that case, I think to myself, if this isn't true SPS, if we are dealing with a case of chronic Lyme or neural Lyme or whatever, then the exosome treatment may be successful or has a chance at being successful. Because when I saw those GAD antibodies, I kind of, especially because I was feeling so horrible, I kind of felt a bit discouraged, because that just confirmed the SPS diagnosis and the fact that the exosomes may not be working or may not be successful in the long run, because SPS is not an easily treatable condition. I'm not 100% convinced that I don't have stiff person syndrome, but I guess there's a part of me that's like, well, if this isn't the typical case, or if it's not a true case of SPS, which is the vibe that I'm getting from the neurologist and from my immunologist, that this is not a true case of SPS. If it is neurological Lyme, if it is some other kind of autoimmune or inflammatory neurological response, then I have a chance. Then I have a chance that the exosomes could work and bring back some of that neurological function. Granted, I'm still not feeling great. I'm not feeling better, but I'm doing better, from the flare. But I just wanted to kind of make that amendment and make that clarification, because I do think a lot of times, one of the things that I have noticed in almost any chronic illness community, particularly the Lyme community, is that as patients, we interpret our own blood test results, our symptoms, and all of that. We interpret it a certain way, regardless of whether doctors agree with us or not, or whatever our doctors have told us. And I've always been very, very careful to not jump the gun. I know a lot of us have had bad experiences with doctors, and we have gone on to find other diagnoses, or we just self-diagnose and we say, well, I know I have this, this, and this, even though the doctor doesn't agree, or the doctors can't find what's wrong with me. I'm always very cautious not to do that, because I do trust doctors, even though I've had really bad experiences with doctors. I still do trust them because they do know more than we do. They have the medical knowledge, they have the education to understand that. Do they always do what's in our best interest? No. I think that's the bigger issue, is that they don't do what's in our best interest, and they're not going to go the extra mile because they're busy, or they're tired, or they're not going to fight with insurance because they know it's a losing battle. But I wanted to make sure that I gave the most accurate information that I could, because me saying, in a previous vlog, I finally tested positive, when I have two doctors telling me number is not high enough, and it could possibly be from the IVIG, which again, I don't think that's the case either, because how would my doctor have known to test me for that post exosomes? What was she looking for? What was she trying to find? And she wasn't, my immunologist was not under the impression that I was going to stop IVIG. I was going to continue with IVIG throughout this exosomes treatment. This is just something that we didn't anticipate. We didn't anticipate that I was going to have to stop the IVIG. So she didn't know, we're stopping the IVIG and the GAD antibodies will slowly improve. She was under the impression that I was going to continue it. So what was her reason behind running the GAD test? So I guess we'll find that out later. I will keep you guys posted on that, and I will let you know more information as I get it. Like I said, I'm not going to be seeing her until July. I will probably do a 4-month check-in, which is actually just a few weeks away, I think. But I just wanted to clarify that because, like I said, I don't want to be giving weird information. I also want to give you every possible answer, because if you do turn up positive for these, for this antibody, and you are on IVIG, or you're diabetic or something, I don't want people freaking out and thinking, oh, I've got, SPS, or I've got some other kind of neurological autoimmune condition. It might be tied to something else. And so that's kind of what I'm trying to figure out. And, unfortunately, my doctors can be are poor communicators sometimes. And also, too, I think because of the nature of this type of treatment, and that it's experimental, and that it's not, fully accepted in, like mainstream medicine, the doctor doesn't really want to say too much, I think. She's trying to be cautious, I guess. So I'm just kind of letting it be, and I'll just, get in touch with her when I see her in July. So I'll update you guys on that, but I just wanted to make sure that I made this video because I don't want people freaking out over it. I know people come to my channel probably for information regarding their own medical issues, and I don't like scaring people unnecessarily. I don't like being scared unnecessarily either. So yeah, so that's just that's the deal with that, and I'll see you in the next one. Take care.